Aletha Maybank. My background, I usually now say my background is I'm a person first born here from Antigua. My parents were immigrants, and I have lived in New York most of my life. Harrisburg, Pennsylvania is actually where I grew up, which shocks a lot of people based on who I am. I went to school in Baltimore and Philadelphia, and then ended up here in New York City. I am a pediatrician and preventive medicine public health doc by training. I practiced for 2 years as a hospitalist here up the street at Morgan Stanley Children's Hospital. When they first opened, actually, I was one of the docs that transferred the babies over in the NICU at that time. And then I ended up doing the second residency at that point in time in preventive medicine public health, which afforded me this opportunity to start an Office of Minority Health in Long Island. I was asked I wasn't even finished with residency, but they asked if I would start that office. My program director agreed and thought it was a very good opportunity. And so that was my entry into kind of the job market, but also public health as well as government all at the same time. So I launched that office, started it, was there for 3 years. Then I was recruited to New York City Health Department when Tom Frieden was here, and Mary Bassett was here as well as a deputy commissioner at that time. I oversaw neighborhood health in Brooklyn and in Bed-Stuy and kind of the communities that were the most underinvested and had the worst health outcomes. And then Dr. Bassett, de Blasio became mayor, and Dr. Bassett came on as the health commissioner, and she asked if I would come to the central office, was promoted to a deputy commissioner, and then launched the Center for Health Equity in New York City and started the whole work around that. And then I oversaw all the neighborhoods across the city that had the worst health outcomes. I left there, 2019, and ended up at the American Medical Association to start their Center for Health Equity. I was the inaugural Chief Health Equity Officer there as well, and a Senior Vice President. And I also, in the meantime, advised the CDC Director as the Senior Advisor on the equity infrastructure within the institution, which will bring up a whole lot of great conversation, because clearly I'm saying equity a lot. And a lot of folks usually have a lot of questions about that. But I would say if I describe my career, it's been these really unique opportunities. I've never had a job where there's a roadmap in front of me, which I'm very grateful for. I've always had to create. I've always had to design. I've always had to think through what is the strategy, the execution, and what is the team that needs to be there in place in order to build the team. And I would say definitely public health is more my bread. People know me as equity, but that's kind of the lens, the process and the outcome of which we were holding people accountable to the values that the institution said they had. But really the bread and butter of who I am is public health. And that's my love and my professional love. I was actually speaking at the New York City Department of Health yesterday at the ask of the commissioner. And I'm here. I resigned in December. So I'm figuring out my life and smiling while I do it.
Well, it's an amazing career already. And I think you've been involved and done so many important things. But one of the things that you didn't mention is you're also an artist. You said you're a creator. Yeah. And I think one of the things that we've been trying to do as healthcare is, inherently human. If it isn't anything else, it's human. We can, it's broken. It's lots of things, lots of work to do, but it's human. And as we talk about that intersection of technology and the implementation of AI, we're trying to kind of make this discussion about the humanity of it. And I think the creators, and as we know and meet all the people who work in healthcare, that's what we care about. So as you're kind of being a creator and an artist and working in healthcare as a pediatrician and as a public health advocate and equity advocate, where do you see the potential? And
So thank you. Well, so this is the part of being not an institution anymore, of figuring out what is my identity, how do I describe myself, what seems most meaningful for me, or for the audience that I'm engaging with, whatever it is. And it might not be like a big audience. It could be a small and even the individual person. And so my whole career has been physician. Now it's I get to choose, which is kind of quite awesome, I feel. I tell people I'm more of an artist, I feel, than I am a scientist. I grew up piano, dance, singing, you name it. I was there. So I recently launched a film studio as well. I'm very big on, thank you, I appreciate that, big on narratives and the narratives that we put forward. That's been the thread of my career. Most people who know me have a sense of that. What are the narratives that we are saying, and then acting upon, because we act upon the narratives that are most meaningful to advance the health for all people, really. And so I don't feel, and I think we all know that not all folks' narratives, or not even all the narratives around health itself. I think the narrative around health is very narrow in this country. It is much rooted on kind of the healthcare side, very technical, which is fine to some level, basically about basic science. If you think about all the shows on TV, if you were to name a health show, where do they all happen? The hospital and ERs, right? Or surgical spaces, maybe. But that's the only way health has typically been demonstrated. And it seems normal for most people. You don't even really question it. But there are so many other stories to be told, even about systems, that just don't get told. So I have a very strong interest in, telling and sharing those stories moving forward. And I think that the part of it is, in terms of the humanity, I was fortunate when I was deputy commissioner that the commissioner at that time, Mary Bassett, allowed us to pursue art and engaging with art and community, because it's a good way to pull people into the conversation, because we all actually value art on some level, or culture. And I'll say it more broadly, culture, whether it's music, whether it's visual arts, whatever. We all listen. I would think all of us listen to music at some point in time. But that's where everybody is at. And so if everybody is there and it's something that we all care about, then how do we leverage culture and the arts more to bring people into the spaces where we need them to be, as well as also meet people where they are? And so that's kind of the drive of where I'm at right now, and figuring out what all of those things mean.
Yeah. And I think that's so important as we look at how, I think storytelling and, misinformation in healthcare and education and engaging people in their health. I mean, we were just at HIM SoCal and talking about, kind of with kids, with children, and how you engage them in their healthcare, and sort of this call for gamification and very much storytelling. So later in the program, we have Gary Forbes coming, who has written a book called Soul Survivors, which is a comic book, but to help kids, and the superheroes and the kids, it's all story. It's all coming together, right? And it's all about storytelling, and his story. And he's an NBA player, was an NBA player, is now wanting to, and he has diabetes, so he's trying to engage kids around their chronic disease. And I think that's so important. And there's so many avenues where we're missing that in healthcare.
When I was at New York City Department of Health, and I'll bring it up a lot because it's really a core of, I feel it's one of those, you go, there's somewhere you go and there's always some piece of you that always rests from an institution, I think, that you were in oftentimes, because it just had that much meaning. But if you remember, anybody remember the smoking ads, right? You all remember the smoking ads, the sugary beverage ads. We all remember them, right? And so I think about, why is that? What investment had to happen in order for that to occur? So investment in will, number one, that the data that really demonstrated we need to do it, that there's the scientific will, but then there's the will that we should put the dollars and the investment into doing this. So I remember, the content that was created, great content, but it was really what amplified it is this intention and understanding that in order to get it across the country, you have to spend millions, multi-millions of dollars. People who are in marketing and advertising have a clear sense that to get anything out that far, this is before social media, that you had to invest, and you still have to invest lots of money. CDC would pour money into the Department of Health to make sure that these ads got everywhere. And they were so transformational. And I think about that level of investment in order to get people to move. Most people don't have multi-million in health care. unless it's like, pharma on the pharma side, maybe, and some other places, tech side, I guess, to some level, big tech. But for the most part, people in public health departments who are really creating a lot of these messages don't have the funding to reach people in that kind of way to really be transformational. There's so many I love Ad Council rather, great campaigns on their website, but nobody knows about them. And so where do they need to do? How do we need to partner? What do we have to do strategically in order to either amplify the messages or partner from the beginning in creating and then figuring out what is distribution? And so that's been the value of social media. One of the values of social media is that, there's this platform now that if people are good at it, not everybody's good at it, but if you're good at it, you may get your message across. So one of my mentees is Joel Burvell, who's considered the medical myth buster. Some people know about him. He's reached so many people, right? And he gets paid for it now, and he gets lots of ad dollars, but he's not paying to distribute, right? And so social media is a great platform, but not everybody can do that. And so this is where then I think about culture and the opportunities around that. And I can talk more about like what I'm doing in that space as well. Yeah. But I won't.
Tell us a little bit more, because I think it's also just, how can we, both as whether we're technologists or clinicians or, working in the healthcare space, it is telling that story and getting, whoever it is that we're serving in that market engaged.
Right. And I think, and I'll say 2 points before what I'm doing, but the other thing that I recognize about health, and this is we have to own it, is that we have a certain type of, I'm going to use the word, I don't know if it's the supremacy, in the sense of we feel that because we put it out, that people should pay attention. There's a strong sense of that because we created it and, it's good, or this is the advice we're providing that people should automatically do it. And the reality is that it doesn't happen. And so, and we get those signs and signals over and over again. And I feel this is why we have to have better bridges, more understanding. This can be rooted actually in, we were talking about education of students, education of all kinds of professionals, in what do people really value? I mean, that's a marketing concept, right? You go to the values of your audiences. And if you understand that your audiences value certain types of cultures and certain places and experiences and ways of moving, then we should be paying attention to it. A great example, again, New York City Department of Health. When I was first deputy commissioner, we had a lot of work on like active transportation, riding bikes and all of that. Most people ride bikes. Well, I won't say most. A lot of people ride bikes. And it's a good form of exercise. But what wasn't in the consciousness of a lot of folks? And at that time, the majority of assistant commissioners were actually white privileged folks in the sense of financial and education privilege, who had a certain way of being. Bikes were very popular, but they were trying to impart the same kind of programmatic work on Black and Brown communities. And it's not that Black and Brown communities don't bike, but it wasn't a priority for them. And so when bike lanes started to be put down, I would get the feedback, because I oversaw the neighborhoods, well, that's racist because they're trying to slow down traffic and they know we have asthma. That's where the mindset goes. And so again, it's understanding what people value. It's not that they wouldn't value bike lanes over time, but how do you get that? How do you understand that? Where do you meet people at to understand what's going to be of most important first? And then you can get people to act first and then move into these other pieces of where we know health is really valuable and things to have in the neighborhood. And so we ended up doing a whole community collaboration. There were business leaders at the table in the community of Brownsville, community residents, DOH, health department, the transportation department. We had grants. We did them all together. And it was one of my favorite kind of opportunities of having this collective impact. And I remember people sitting around the table with big maps. And this is where we're going to put this bike lane and this bike lane. And then we're going to do all these infrastructure improvements. And by the end of it, all these bike lanes were put down. The community was a part of the process. They were able to inform that, and they were able to make the streets actually safer in that community and created connectivity, which is a really important concept when it comes to, I'm going to use the word freedom, but the ability to be able to ride a bike around the city. So it was able to go from one part of Brooklyn the whole way out to the south part of like Brooklyn, if you understand, what do you call that out there? I live in Brooklyn. Oh my goodness. Coney Island area. Yeah, thank you. Goodness, that's okay. But it was great that it created that connectivity. So those are the possibilities, but most people don't take the time about it. Most people don't know about it. But to me, it's still very basic. It's marketing. It's for people who do marketing. It's understanding what do people value and how do we get them there.
So talk a little bit about your experience at the AMA and, as the inaugural equity officer and sort of where that started, where it ended, where it's going, do you think, in terms of healthcare and kind of weaving that into sort of the storytelling and meeting people where they are,
Yeah, I've evolved a lot. I mean, it's been my career. As I said, I feel it's this lens. I think for me, at this point, I do a lot of just trying to dispel like these myths around the words like equity, diversity, and inclusion. Because it's just, I've never used the word DEI or the 3 letters in that way. Because DEI historically was something that was related to HR and related to the workforce and very important. I'm not an HR expert at all. I am an equity and health expert. So I focus more on the context of health, clearly, and the data and what happens around that and what solutions do you put in place. But then at the institutional level, where I've also been, what's happening within the workforce is very important, but it's also what's happening within comms, what's happening in IT. There are equity lenses to put in place in all these places within an institution. And so that's what I held accountability to. And really the whole drive of these programs was post-civil rights. I mean, there was the civil rights movement that didn't just help Black people. It helped actually the majority of Americans in this country, women included, those who identified as being disabled, those who are not from this country, to have opportunities to have jobs and to be able to live in places where they weren't able to live before. Most Americans benefited, if not all, honestly, from that particular era. But we were clear, not everybody understood that, and that decisions that were happening at the institutional level were not still appreciating and valuing this context. So that was a way to hold accountability, the program. That was it. And so then the other part to it, at the end of the day, if as a health person, as a doctor, if I know that somebody does not have the opportunity to experience, many of you are creators, if people don't have the opportunity to experience the solution that you have and you have created, then I need to care about that, right? And also it's an ethical consideration then, because that means that I'm harming somebody and they don't have the opportunity to experience that solution. I need to care about that. I should care about that. And that is all that this, to me, the context is. And it's, to me, then becomes a human context of whether or not you care. And so that's what I ended up starting to feel my job was. I was getting paid a lot of money to help people care about things outside of their own self-interest. And that's where it really, to me, I felt like that's where the rubber hit the road. It's so easy for people who don't have an experience, that's anybody, right? And all of us can be under this particular trap and lens in a way, for us to disassociate ourselves from what we don't know and don't experience. And when you have the power to do it, you can do that. You can do that for your institution or your company or whatever. And it's part of just saying, how do we care better as human beings? And I don't know how we do that to some level. I mean, part of it, I could say, yeah, let's be in proximity with each other. Let's love one another. And I'm one about a believer of love. I do believe that. I think that is the core of the context, is how we love ourselves and each other. But I can't force that upon people. If people weren't raised in that way, then that's a condition. That is a problem, clearly, that's bigger.
Right. Well, and it ties back to, meeting people where they are and making them care about what they care about and bringing them, further, whether it's, within an organization from an AHR perspective or healthcare, right?
Yeah. So, we can meet people where they're at the best, that we can. And I think at this point, for me, meeting people where I'm at, and I guess it's where I'm kind of in the space I mean, I'm doing a lot of advising, consulting. I mean, that's given for many different things. Some people want support with what to do, how to evolve. And I'm not one to say use the words equity, diversity, and inclusion if it doesn't make sense for your institution at this moment, because at the end of the day, you need to care for your people. And I don't want folks to lose their jobs. I don't want money to get cut for certain reasons. You know, it's not illegal, first of all. So the the backtracking is still a little bit confusing in my head when it's not illegal, period. So the fact that it's still happening also just represents, to me, again, an underlying, how much do we care about people really, and what are we doing? And so I'm in a space, I've been helping the Global Black Economic Forum, in essence. Some people may have heard the product, Shea Moisture. It was sold by Richard Lou Dennis, who by Unilever, and then he bought Essence Platform, launched Sundial Media Group, and bought all these media platforms, Refinery 29, Girls United, BeautyCon, and Essence launched New Voices, and also it launched a sister agency called Global Black Economic Forum. So it's the largest in the world platform for communications and media for not just Black people, but people of color and women. And so I've been engaging with that on figuring out how to leverage that entity to work to advance health. And so coming up at Essence Fest, July 4th, which has been the last, 20, 25 years. It's been a long time running in New Orleans. It's the largest festival in the country with 500,000 people over 3 days. And they have different experiences. A lot of people saw the movie, so they think it's all about fun. It is fun, but it's not all about, drinking and partying and being in New Orleans. There are concerts at night that happens, but during the day, the convention center has lots of brands and companies and engagement. And so we're working on launching the health arm of it. We have a health innovation hub, actually, in which founders who are underinvested, typically don't get capital in the ways that other ones do, have now this opportunity to have actually direct to consumer engagement, which is very different. There aren't many entities or places that actually do that. So there's a whole hub of about 8 or 10. We've been growing it for the last 3 years. I started that actually when I was at AMA. And then we also have the Future of Health initiative that's being launched through the Global Black Economic Forum. Again, really trying to bring this intersection of political leaders, health, democracy, work, and wealth, it together for experiential opportunities. We have a neighborhood we're building out, and we've gaming. We talked to a whole group of gaming people. So we're going to build that over time, because I do think gaming is a really important space. I think it's like 72 more women game than men. I didn't know that. I didn't realize that. And I think gaming can be a really powerful tool
Different kind of games.
Yeah, all kinds of games. Yes, exactly.
Totally. That's great. I'm so excited to see it come to pass. And in terms of like how folks can get involved in that, I assume there's a website and all that.
Yeah, or me, I'm on LinkedIn. Yeah. Okay. However you want. And then I don't know if you want to be saying anything about AMA or no. Okay. Well, I'm not there. I don't know. I think I said some of it, but I just feel the work. I think all institutions need to decide, what they're going to do at this moment, clearly, and they are. The hope is that, they make choices that support their stated commitments, because a lot of people are not doing that, and that they're supporting the people that are there in their institutions. A lot of people are harmed right now, and we're in a place in this country where we all understand that we're in a moment where people are going to have to make a lot of decisions on what they want to do, how they want to stand up, not only within the institutions that they're working or that they're leading, but with their own communities, with their own families. We all have the same value, that we do all want to live long and healthy lives. I don't know many people who don't. I just don't. And so if we can honor that amongst each other, better, try at least, right. We'd be in a better place.
Yeah. And a lot of that is around, the importance of health to that longevity, to that life, and sort of the quality of life.
That's
of
right.
how you get there. Well, one of the things that we're about at Health Impact is audience questions. We incentivize them. You get tickets when you ask a question. You then get enrolled in the raffle. So for the Aura Ring at the end, I forgot to mention that in the beginning. So do we have any questions, any comments, any thoughts? As you think about that intersection of technology and healthcare and culture and communication and storytelling, do you have any thoughts? That's Cletus.
Great. You want to? No, you can hear me. Great discussion. Thank you. Great discussion. I love what you're talking about, and particularly around the intersection of media. Throughout the years, we've seen media manipulate us. Or milk, these type of things, including adult cigarettes, right? So some things are good, some things are bad. What do you see us with around, public health? Will there ever be a day again where we can actually use the promotion and marketing, like things that you're doing, to actually have positive impact? I remember the Yuck Mouth commercials in the 70s. These things were transformative, right, to young minds, or your Brain on Drugs campaign. These things really stuck in our heads. Do you see us getting back to a point where the government helps fund so that we can actually have, these kind of positive health outcomes?
I mean, I don't know if I hope so. I think the question is, well, the answer is rather several points. I would like to see us get there for sure. Is the possibility? Absolutely. Is the challenge now within federal government? Absolutely. I can say that. Doesn't have to be a Health Impact, doesn't have to say that. I'll say it.
Okay, we'll say
because the reality is true. I have many colleagues who aren't working anymore who used to do this kind of work at the federal level and put the investments in that I was talking about earlier. But this is where I think and local governments, state governments, and city governments do not have, and county governments don't have the resources at all. They're struggling. And I think if we don't have a transition also in the infrastructure for public health in this country, which all of us benefit from, have always benefited from, we benefit, as we're sitting here in this room, we're going to continue to see less and less, even less promotion, because we're going to have to respond to whatever immediate, crisis or disaster that is happening. And right now, COVID is right. It's a kind of sustained, that yesterday data came out actually for the first time. This is why at the health department that New York City life expectancy is now back up to the same level that it was prior to COVID. It fell about 3 years. During the time of COVID. So the announcement was yesterday that we're now back up to the same levels. And New York City actually is on a trajectory to have one of the longest life expectancies for a city in the country. So that's all good news. Clearly, the challenge of it on one level, so I don't know how much good news, is that there are many communities across the city that aren't experiencing the same opportunity. But overall, still, everybody's still going on that same trajectory. And so, New York City is a place that has prioritized health and the public health infrastructure. And especially, I can go back from since the time I've been in government, Bloomberg was known to be a public health person, right? He has a school of public health named after him. So he prioritized it. And I think the city more so than most prioritizes it. So we have more investment in promotional materials and ads and all of that. But that's just, again, a will, I think, distinction, because political leadership will kind of determine a lot of that and where investments go in that way. And this is where then the opportunity is around culture, leveraging culture, folks like myself and other health leaders who have, these larger networks and understanding and some influence can work with these folks to create campaigns. I think we have to figure out what that nexus is of who's going to create campaigns. You have the ad council, but we have to figure out how are they going to be leveraged.
Great talk, and thank you for your advocacy in this space as well. I'm Christopher Cunny. you touched on a little bit of the issue around Black and Brown entrepreneurs' challenges in securing funding and support to launch their platforms in this space. I'm just curious, are you working with, you just mentioned Bloomberg's school. Are you working with other, academic institutions, HBCUs, and to really help create potential tech accelerators that focus on helping to cultivate this next generation of health tech leaders of color?
Yeah. So when I was at AMA, when I was figuring out what the strategy needed to be at the start, I started to get a lot of influx, folks, a lot of founders reaching out saying they didn't have this investment. Mind you, I came from public health, so I didn't know much about the space yet, really at all, because it's not a public health, which is another interesting challenge too, because it's not like in the definition of how you all think about innovation. Innovation, we thought about at the intersection of like who's at the table and how are all different voices coming at the table to produce a solution. In healthcare, it's about who's starting some level of technology or solution and then getting it sold and getting it paid, right? It's a different context. So I didn't have it. So a lot of founders were coming to me saying, expressing this particular gap. And so from that, brought together other kind of leaders who were at the intersection of technology and equity to learn what was needed, what would be needed from a platform like the American Medical Association to push forward. And what they stated and felt is that what was lacking were just even principles at this time. This was now, so I started my role in 2019. COVID came like 8 months later. And then the public murder of George Floyd came about a year later. And so once that moment happened, there was lots of openness, honestly, at that time to name all these issues, right? And this is why we have the backlash that we have. Well, one of the reasons why we have the backlash at this moment, but to be able to talk about equity, justice, racism, all the things, right? And so we were able to then launch principles because they felt that that's what we needed to do because folks were giving money left and right and didn't even know why they were giving money really. And what were they giving money for and how was that money going to be executed or implemented and executed, to do whatever it is they're going to do. So we needed to have some guiding principles. So we launched something called Info Health. I think it's still existing, Info Health, and worked to create principles, but also a business toolkit for what companies could do or investors could do in order to ensure that they were having solutions and strategies that ensured opportunities for these founders. And so the work was really a lot of listening, a lot of doing what I'm doing now, advocacy. And then in terms of, and through that process, I met tons of folks, tons of founders, but also a lot of inventors, less venture, because venture just doesn't work for Black and Brown people. It just doesn't. It's consistently doesn't work. The percentage of money that goes to women, people of color, those who are disabled is very small. And so that means to me another solution needs to be created on how we can actually start companies and technology companies, especially in healthcare, because we aren't valued. That's to me the bottom line of it. We are not valued. Our ideas are not valued. The solutions are not valued. So we have to do something differently. And some people hear that and they're like, I'm like, well, that's the truth. Look at the data. We like data. Look at it. And so I've met lots of folks like at Howard. They do have an incubator, an accelerator there as well. There's C Ventures. There's Unseen. There are a couple that are around. So I've been working with them to figure out, how to leverage and amplify. But I also feel the reason why I'm also working with like an Essence is, and more the consumer, I think there's a cultural shift that also can happen for communities to better understand entrepreneurship beyond like beauty products. And not that beauty products aren't good, but how do we understand that we can also be health providers or health creators? And then also, how do we collectively invest in it? Because I feel that is our model to use, is the collective investment type models. We invest as a Black and Brown community in so many things, right? We spend our dollars. Everybody knows that as well. And so if we can have some shifts in that, then that's kind of where I'm at. That's a big job. That's bigger than any job I would have had in any role. But, you know, I'm a believer. So that's the direction that I'm going.
I believe you can do it too. Well, that was great. I think we're out of time. I wish I could
Sorry, my answers
could
were long.
go on
Apologize.
all day. But thank you so much, Dr. Maybank.
Thank
It's
you.
great to have you here. And
Thank you.
great to
I appreciate the opportunity.